Welcome back, everyone. I'm Lindsay Burton, functional medicine health coach and head of operations at Illuminate. We are so happy to have you back. We are tackling something very special in our conversation today, something that's probably close to a lot of families' hearts. We're going to be talking about the autism spectrum disorders and how we approach them through a functional medicine lens. So, again, we have Dr. Jennifer Franklin joining us and Mary Margaret Burch, our nurse practitioner, on this call. And Mary Margaret brings something really special to this conference. So not only does she have years of clinical experience treating children on the autism spectrum, she also has children on the autism spectrum as well. And so not only does she have this component of she knows what to do clinically, she has also lived the day in and day out of how do you navigate the needs of your child specifically. So, Mary Margaret, we're going to start with you today. Can you share a little bit about your journey as a mom and how that shaped your approach on autism as a provider?
Yeah, sure. So I've got two kids. They're both older now, late teens. With diagnosed with autism and some complex health challenges. So it's brought a lot to my clinical practice. But I would say that it's taught me a lot about what it's like to go from doctor to doctor when people don't connect the dots. It's taught me a lot about the isolation that you feel as a parent when you have children that are different, attending parties, even small things like that. I understand for lack of a better word, the bone deep, I mean, just deep exhaustion, hours of research, advocating for your kid. I think having personal experience has taught me what it's like when I recommend things to other families. I've pretty much done just about everything I recommend, so I know what it's like.
Yeah.
Implementation, testing, everything. So it's been quite the journey. I can look back with a lot of joy. There was always joy in the journey, but there's a lot of
Mhm.
heartache too.
Yeah.
But I can look back and where God has brought us to this point, and it's been quite amazing.
Yeah. It's just amazing to hear your story. I'm so glad we're getting to share it with other people today. Could you tell me what is something you wish providers understood when you were navigating this with your own kids?
Uh, I would say that autism does not define the child. So, in other
Hmm.
words, if a child is having constipation or loose stools, that's not just because they have autism. If a child is extremely aggressive, that's not just because they have autism. They may be in pain. There may be a food issue going on. There's some underlying reason why the behaviors and the symptoms are coming forth. So that would probably be the biggest thing when families it happened to me too, you're dismissed because that's just the diagnosis.
Yeah.
And that's the way it is. And that's not true.
Yes, I just keep hearing this story of you've lived it and you understand what it's like to prescribe those pieces. And I just think that is an amazing lens that you bring to appointments with
Yeah.
our families kind of dealing with these same needs. So this perspective is invaluable. But Dr. Franklin, what makes the functional medicine approach different from what families typically experience?
Yeah, I feel like when we see families that have children on the autism spectrum, they've been through the conventional system, and this is just
Mhm.
what's offered: ABA, medications, and those things can be great, and we can come alongside those things. But they are still looking for that missing piece. And I love, Mary Margaret, that the symbolism for autism and for the research is a puzzle piece. It is a puzzle, and there's a saying that says, once you've seen one autistic child,
Mhm.
you've seen one autistic child, right?
Mhm.
They're all different, exactly like you
Mhm.
said. That's not the label over them. It's just this diagnosis that they carry. And so it's our job to kind of dig deeper in. And that's what functional medicine does, is looking at the root cause. So we are looking at the gut and imbalances
Mhm.
there and that gut brain connection. We're looking at the potential for toxins that they may have accumulated prenatally or after birth, how they may have inflammation in their bodies and how they respond to that and their immune system gets dysregulated. And food sensitivities going along with all of these things, putting the pieces together, mitochondrial dysfunction. Could they have folate receptor antibodies? And we can test for that and
Mhm.
treat that, right? And
Yeah.
she'll tell you these kids can begin to speak that were nonverbal before, and just these amazing things when you put the puzzle pieces together.
Mary Margaret, I know you've had years of kind of clinical experience, and we often tell our patients we are not miracle workers. So we don't promise any outcomes. We're going to do our best to kind of walk through that process with you. But Can you share some specific examples of some wins that you've had in treating families with autism from a functional medicine approach?
Sure. One child in particular, it always amazes me. Again, a lot of this is education, making small incremental steps depending on
Mhm.
where the family is. So, 9 times out of 10, diet change is a great thing for these kiddos. So, I had one in particular. Some testing showed definitely gluten was an issue for the child, but it was just difficult for the family to get that out of the home. This is very not totally nonverbal, but didn't speak much at all. It took about a year to fully get gluten out of the diet,
Mhm.
but once we did, the child's language began to explode.
Wow.
So, did gluten cause her not to speak? No, but the inflammatory process that gluten caused was part of the problem. So, that is a big one. I have had multiple kids, not one in particular, but once digestion is improved, especially
Mhm.
we'll see a kid sleep through the night. Sleep
Mhm.
is a huge issue.
Yeah.
Generally, again, there's detox issues or gut issues with that. So, I've seen multiple kiddos with that. Behavioral aggression symptoms, I've seen that improve drastically with diet changes and with correcting the microbiome. So lots of good things can happen fairly quickly. Doesn't mean it's perfect, but again, there's a lot of potential.
It's wonderful to see those, success
Mhm.
stories, and I know everybody's looks different, and so sometimes we see these big changes for families, and sometimes even those micro changes of, getting sleep through a night is a huge win for
Yeah.
those families. One thing that we always talk about at our practice is collaborative care, and we've really built this team approach. So we have medical doctors, we have nurse practitioners, we have health coach, and then we have a variety of other resources that we kind of refer you out to and partnerships. So Dr. Franklin, kind of explain what that process looks like for a family with autism coming in. How do we use that collaborative model to really support them best?
Yes, I think it's imperative, especially with families with autism, to have different team members and bring their expertise and their support to that family. And that is sometimes what's missing from conventional medicine. There are some great multidisciplinary autism clinics, and they've modeled that as well. And I think
Mhm,
it's absolutely imperative. And then we're also collaborating, as you said, with people outside of our clinic,
mhm.
like their physical
Yeah,
therapists, their occupational therapists, speech therapy, all of these things. And it really does take a team approach. So we love being a part of that.
yeah. I just love to kind of highlight that piece of we are not the sole fix. It's really that team approach is where we see the most success for our families, and we'll try to guide you along in that process as you work with our team. So, this is such important work, but before we close, I want to ask if there's a parent watching who feels very overwhelmed right now because they've tried everything and they're exhausted, what would you want them to know? Mary Margaret, we'll start with you.
I believe families with autism are quite amazing. By the time that I end up seeing many of them, they're exhausted. So I'd say take a deep breath, take it a day at a time. We will walk alongside of you. Again, because I've walked this journey, I have the privilege of being able to look back and see where could I have kind of like taken a pause? Where did I
Mhm.
miss a little bit of that? And try and help the families through that because there's just so much hope. And there's so much that can be done for these kiddos. So I think that's important.
Dr. Franklin, what would you tell parents?
Yes, without having the personal experience of it like Mary Margaret does, I just sit across from them and just have so much compassion. As she said, they're so resilient, the kids and
Mhm.
the families. They pursue this with such strength and such strong advocates for their children. And I always just applaud that and just want to give them a big hug and tell them
Mhm.
there's hope and we're with you, we're for you, and just make them feel uplifted before they leave our practice.
I love that. So, thank you both so much for sharing today. And if you are a parent who wants to explore functional medicine and what that might look like for your family in this process, we would love for you to reach out to our team. Visit our website at illuminatemed.com. There's a variety of information about how we treat our providers and other members of our team, and even information on scheduling an appointment. So feel free to visit our website or call our office. We'd love to support you on this journey. So thank you both so much for joining me today.